at UCLA School of Nursing to talk to CNLs about reducing cervical cancer in Latino women. It's known that Latinas have the highest prevalence of cervical cancer in the U.S. So let's hear how PAP and HPV screenings for 30 to 65-year-old Latinas can help. I'm here with three CNLs, Jay Kim, Melinda Davis, and Dawn Jung, who have been researching HPV screening trends among Latino women. First of all, tell us about HPV and cervical cancer, and what's the current screening guideline?
First of all, the cervical cancer does not have genetic component unlike other cancers. Unfortunately, each year in the U.S., about 12,000 women get cervical cancer and 4,000 die from it. Yet it is the most preventable cancer. HPV infects genitals of both men and women and usually has no signs and symptoms. It often goes away on its own, and only when HPV remains in the cervix for many years, that puts a person at a risk for cancer. Therefore, early detection is the key. As for the procedure, there are two types, the PAP test and HPV test. The PAP test looks for abnormal cells in your cervix. On the other hand, HPV test looks for specific types of viruses that cause abnormal cell growth. The USPSTF recommends that all women between the ages of 30 to 65 to obtain both tests every 5 years.
Is there any evidence for use of the screening procedure to reduce morbidity and mortality?
Yes, according to USPSTF, since the screening was implemented, cervical cancer deaths in the U.S. have been decreased by 60 to 90%.
So what is the current adherence to the recommendation among Latinas? And do you have any evidence of health disparities compared to other groups?
Well, according to the CDC, Latinas have the highest incidence with 12.5 cases per 100,000 compared to 7 in non-Hispanic white women. The average mortality rate is 1.5 times greater for Latinas. The National Health Interview Survey indicates that 75% had a PAP test in the past 3 years compared to 81% of non-Hispanic whites. One study reported a low rate of physician recommendation for the screening. Only 14% of Latinas highly proficient in English, and about 8% with a low proficiency received screening recommendations.
So can you identify some risks and limitations regarding the screening procedure, and are there any controversies with it?
Okay, so this screening does involve some risk. About 6% of women who receive pap smears are referred for additional testing, which could include invasive diagnostic procedures. Risks include anxiety related to positive test results, time and burden caused by false positives. Currently, there's about 3% rate of false positive PEP test results. HPV screening generally has a higher false positive results, ranging from 5 to 17%. But with a combination of pap smear and HPV screening every 5 years, the screening is just as effective as a pap smear alone every 3 years in detecting cervical cancer.
The reason I brought you here was not to discuss our past relationship, but to discuss the fact that I have an STD, and I'm pretty sure you gave it to me.
Why would you think that?
Because I've been having protected sex with my current boyfriend, and also he doesn't have HPV.
HPV?
He was tested and he doesn't have it.
Oh, your boyfriend was tested for HPV?
Yes.
Well, that's absurd.
And why is that absurd?
Because there is no test for men.
Can you briefly tell us the prevalence of adherence to the recommended guidelines?
So Latinas have the lowest rate of pap smear screening when compared to other ethnic minority groups. According to cancer statistics for Latinos 2012, 73% of Hispanic women reported having had a pap test within the past 3 years, and the rates are lowest among Mexican women. Most importantly, non-adherence to recommended follow-up ranges from 20 to 90%. It depends on the region and the barrier that we'll discuss in great detail, such as low SES and lack of education. The fear and fatalistic views on cancer, linguistic barriers, culturally based embarrassment, such as exposing and discussing about private areas, especially to male physicians, and feeling less susceptible to cancer are all important reasons for their lack of adherence to the screening.
You mentioned some risk factors and barriers to the screening just now. How were you able to identify these risk factors, and how does it influence their adherence?
Well, we used what's called the health belief model, which basically measures our perceived threat level of a disease and explains how one balances its benefits and barriers before deciding to make healthier choices. The first concept is perceived susceptibility. Our research indicates that many Latinas think they aren't vulnerable to the cancer if they don't have any symptoms. and therefore feel screenings are unnecessary. Perceived severity explains their extreme fear of cancer and a powerlessness to cope with it. This fatalistic view leads to avoidance of discussions about cancer, which becomes a barrier. Susceptibility and severity combined defines the threat level of a particular disease. Now, perceived benefits are what motivate individuals to seek screening. Unfortunately, this is not well distinguished among Latinas because of the belief that screenings are not actually preventative measures. Perceived barriers, as we mentioned earlier, include fear of cancer, culturally based embarrassment, language barriers, and low socioeconomic status.
So what are some effective strategies CNLs can direct to individuals?
So, based on the health belief model, the barriers just mentioned seem to outweigh the benefits. We need to address these issues to increase screening participation. We've discovered that some of the best ways to reach our Latina population include culturally sensitive education, community outreach programs offering appropriate language materials and involving trained personnel from the Latino community are able to reduce perceived barriers within our target population. And churches are also an important instrument that can provide social influence among Latino women. Culturally sensitive written materials such as brochures and newspapers are effective in providing information to Latinas, and writing at a grade 6 reading level can improve understanding among low literacy individuals as well. We also found that many Latinas prefer the radio or TV to learn about new information. This is where we decided to focus our intervention to deliver public health campaigns in a culturally meaningful context.
Now, can you tell us some ways to influence the healthcare system and providers to increase delivery of screening?
Of course, the healthcare system can have a big impact on this population. According to our research, Latinas have the lowest rates of pap smear screening when compared to other ethnic minority groups. This is due in part to a lack of knowledge and understanding of the screening's preventative benefits. A majority of Latinas choose to seek health care only when they see signs and symptoms. So one way to promote screening is to have healthcare providers routinely educate their patients on its benefits, which we believe will then increase the rate of screening among Latinas. Because respect for authority is an important characteristic of Hispanic culture, physician recommendation is highly regarded and is one of the most important cues to cancer screening within the Latina population. Therefore, physicians play a key role in informing these women of the benefits of screening.
For your next big step in efforts toward improving screening adherence, can you describe some social, environmental, or policy implications that you as CNLs are planning?
So many of the barriers we just spoke about, such as reducing healthcare costs and changing the culture of healthcare to focus more on prevention, requires changes on a larger scale. Our next step is targeting the macro level, like policies and national or governmental organizations to initiate these changes.
Well, many Latinas are not aware of great programs like Planned Parenthood and also County Health Department that offers free and low-cost PAP HPV screening. The CDC's National Breast and Cervical Cancer Early Detection Program also provides access to screenings for underserved women in the U.S. As patient advocates, nurses should collaborate with these programs to bring more awareness and create outreach programs. We will involve American Association of Nursing to establish policies that focus on prevention and screening practices for nurses by implementing training sessions to train nurses to be culturally sensitive and effectively communicate with patients to encourage screening.
With the Affordable Care Act, preventative services including pap smears and HPV screenings are now covered free of charge by all healthcare insurance policies. We need to work with physicians and healthcare providers to educate patients about this free service and implement screenings accordingly. To do this, we plan to work with the American Medical Association to help doctors and nurses spread the word. And again, research shows that Latina populations prefer media as a source for obtaining information, specifically radio and TV. That's why we've developed a new health segment on a popular radio station here in LA. We are really excited about the impact this outreach initiative is going to make. The show will feature top educators and even celebrities in the Latin community to address health concerns and to promote discussions on health education. We hope that these types of awareness campaigns will encourage more Latinas to get screened.
All right, thank you so much for your time, you three CNLs. And folks, today we get a glimpse of their new radio talk show featuring a very special artist. Let's go check it out.
Bienvenidos a la estación Promoción de la Salud. Hola Shakira. Gracias por estar aquí con nosotros.
Gracias por invitarme.
¿Nos puedes hablar sobre el examen de Papa Nicolau y HPV? ¿Qué es? ¿Por qué es importante? ¿Y quién debe recibir este examen?
La prueba de Papa Nicolau y HPV es recomendada para todas las mujeres de edades de 30 a 68 años cada 5 años. Esta recomendación es por el servicio preventivo, es muy sencillo y no es doloroso.
Si me puedes elaborar sobre HPV, el cáncer de cervix uterino.
HPV es un virus que puede causar cáncer del cervix uterino y nosotras las latinas estamos siendo diagnosticadas de cáncer de cervix uterino en una etapa muy tarde. Porque nosotros no estamos obteniendo este examen cada 5 años como se requiere.
¿Dónde podemos ir a obtener este examen?
El examen es completamente gratis con el programa Family Pack y uno se puede registrar en una clínica más cercana a su hogar.
¿Y cuáles son los beneficios de esta prueba?
Esta prueba detecta HPV y cáncer del cérvico uterino. No solo eso, pero usted se sentirá bien y en control de su salud. El mensaje principal es que nosotras las latinas estamos siendo diagnosticadas de cáncer del cervix en una etapa muy tarde. Este examen se requiere cada 5 años y por eso estoy aquí para informarles lo importante del examen. Yo personalmente obtengo la prueba cada 5 años y mi objetivo es para animarlas y motivarlas a todas ustedes que hagan lo mismo.
Gracias por tu tiempo y la información que has compartido con todos nosotros en este día. Gracias.
So ladies, remember to get your cervical cancer screening because these hips don't lie.
My hips don't lie.